As provinces right across the country begin to relax restrictions, public health officials are reminding Canadians this isn't over. BC's top doctor, Dr. Henry, told my colleague Matt Galloway on The Current today that a second wave of COVID-19 is inevitable. Prime Minister Justin Trudeau echoed that sentiment earlier.
The question that we're very much focused on is, as that second wave begins, or as we start to see resurgences in a reopened economy, how quickly are we able to contain them and control them? And that comes down to the scale of testing, the scale of contact tracing we're able to have right across the country.
So what might a second wave look like? And are we taking the steps necessary to prepare? Dr. Gerald Evans is the chair of the Division of Infectious Diseases at Queen's University. He joins us from Kingston. Hi, Dr. Evans. Great to see you again.
Good afternoon, Vashi. Nice to see you.
So on that question of a second wave, Dr. Henry said, and I listened to the interview with my colleague Matt, that it's inevitable because every other pandemic has seen one. It would be an anomaly if it weren't the case this time. Can you tell us a bit more about that?
Yeah, we know from historical data from 100 years ago when Spanish flu hit that second waves were extremely common, as they were even back in the 19th century. And one of the things that usually predicts a second wave is when the first wave is not quite as large, it doesn't affect as many people because it leaves a fairly significant part of the population still susceptible to the infection. So a second wave from continued circulation of the virus in the community or the reintroduction of the virus from another site can cause exactly that problem. So I have to agree with Dr. Henry, as I've often done. I think a second wave is inevitable.
So what kinds of things do we need to be thinking about at this point in order to equip ourselves for the potential of that?
Yeah, so really what it involves, first of all, is detection. And to detect a second wave, we need to be very aggressively testing and looking for reemergence of the infection in that second wave. We will require a lot of effort to do contact tracing in an attempt to make sure that that second wave isn't a large, sudden increase in cases. And then the healthcare system has to become very nimble. It has to be able to very quickly de-escalate some of the routine care that we're now planning to get on with and do because it was not able to be done during the first wave. And so we have to be able to then respond to that if there is a sudden increase that leads to hospitalizations, use of critical care beds, in an attempt to make sure that we protect the population.
So let me start on the first part of your answer, and that is around testing. It's been the subject of a ton of conversation, both just among regular citizens, but also politically. Let me take the example of Ontario. So the goal is to process 20,000 tests a day. Some days, in the past few weeks, they've been kind of close, but many days in the past week, for example, the last 4 days, they've been at 50% of that capacity or less. Is that capacity in the first place even enough to be at that prime detection sort of area, and what do you think about us not even getting halfway there?
Yeah, so it's in some ways it's not necessarily a capacity issue. It can be. We've certainly ramped up our ability, our capacity to do a lot of tests. But the essential issue is that even with expanding criteria to test people now with the most minimal of symptoms, in some cases not even having symptoms, but simply a risk factor, even with that, we really don't necessarily have the number of people coming to primary assessment centers or being seen in hospitals where we have significantly ramped up our testing to actually meet those numbers. I'm reminded of the expression is that you can take a horse to water, but you can't make him drink. Patients who feel well and healthy are not going to seek out testing necessarily, and so that's going to impair our ability to get up to a number. And, the number issue has really been very much motivated by I think a lot of stridency from my colleagues and I to do a lot of testing, but with the politicians, it's become a bit of a symbol that here's what I'm doing. I'm going to demand that testing get up there. But testing is not easy. I cannot take any random person off the street and test them. That's not allowed. It's called assault and battery when you do it without the permission of the person who you're going to do the test on.
So what do you think needs to change in order to motivate more people to get tested? And the reason I ask is I do think it depends on the province you're in, because I listened to all the press conferences, even on our watch, for example, and BC and Alberta were among the first to say, if you work in a care home, even if you're asymptomatic, and this was, over a month ago, you can get tested. Then it moved to, if you're asymptomatic, you can get tested. Or if you're asymptomatic and work in a facility or some sort of at-risk environment, they started rolling that stuff out. It appears, Ontario just last week said you can get tested if you're symptomatic. Before that, it was incredibly restrictive. And I remember talking to so many people who were saying, oh, my doctor says I probably won't be able to get one, so I'm just going to stay home. So how long does the process take, I guess, to kind of try and motivate people to get tested more, or that at least they will be aware they have access to those tests?
Yeah, well, I think part of it is to just make sure that people are aware. Here in my part of Ontario, if you go to our primary assessment center, you're going to get tested. Almost no one is turned away, even with the most minimal of symptoms. But the other thing we're doing is we're looking at testing very significantly important populations. Long-term care, of course, has been an issue, and we have tested extensively everyone who's a resident or staff. But now we're going to be aiming our attempts to test on people who are in acute care hospitals, the staff that attend those hospitals, especially if perhaps during this loosening of some restrictions, they've been traveling to areas where there's more COVID-19 activity than there might be, for instance, where I am here in southeastern Ontario. So those kinds of efforts, I think, will help us drive up testing numbers so that we can get a really accurate picture and look for the signal when that second wave might appear.
Kingston has been remarkably successful in all of this. I was speaking to two mayors last night, Patrick Brown and Bonnie Crombie, both citing how good things are in Kingston compared to where they are right now. And with a little bit of envy, you could almost say. What do you think was done right?
Well, without question, we got early social distancing put in place. There was a very aggressive public health movement to put in place all of those things that we're now sort of accept as normal. I was a big supporter of that. I've worked well with Dr. Kieran Moore, who's our local medical officer of health, and we were very fortunate because we put those measures in place before the virus actually got a foothold here. And I'll say the other thing that's interesting is if you look at some of these low prevalence areas, we have a low population density. The density of people in Toronto is about 5,000 per square kilometer in the city itself. The density of population here in KFLA, Kingston, Frontenac, Lennox, and Addington is more like about 500 people per square kilometer. So we have sort of what I call natural social distancing already in place. But I think a lot of it was just early introduction and getting that done before the virus actually hit our community.
I want to also ask you about contact tracing, because we know just about 2 minutes ago, the premiers all got on a call with the Prime Minister. The Prime Minister signaled this morning that a big part of that conversation is going to be about not only increasing capacity for testing, but for contact tracing as well. How important in all of this is contact tracing, and what is the best way to increase the capacity to do so from your point of view?
Yeah, so that's really important in terms of the discussion of second wave, because if we spot infected individuals and we can do effective rapid contact tracing, that's going to be one of the major things that will help us control the size and height of the next second wave. So I was encouraged to hear that there was going to be cooperation, that the federal government has really pushed to saying that they're going to provide the necessary resources to provinces to do that kind of contact tracing in an intensive, quick manner, because that's going to be really important to try and dampen down any second wave that pops up.
Are there other jurisdictions we should look to as examples of doing that right?
Certainly BC, I know, has been very aggressive and very effective in its contact tracing. And even, I would say, Alberta. And here in Ontario, I know locally we've been very, very fortunate. And that's, again, part of our public health unit's work and responsibility to sort of get that done. So there may be other places where that hasn't been able to be done either because resources were lacking and or there was just so many cases. Obviously, contact tracing can completely overwhelmed if you have a lot of cases, and that's the kind of thing that we may have seen in places like the city of Montreal and Quebec, which has had a lot of cases, and to some extent in Toronto as well. There
was also some discussion now about the way in which that contact tracing happens. So the majority is done through volunteers right now, or through people. You call up somebody, you find out if they've, you tell them they've been in touch with someone, things along that nature. But there are also all these apps being developed, and I've seen them in use in other jurisdictions and other countries as well. There are some concerns about privacy there, about rolling it out. What are your thoughts on apps as a means for contact tracing?
Yeah, I think apps are a very technologically advanced way to do it, and we should be trying to use technology. But I'm certainly sympathetic to the concerns that very large corporations like Apple and Google are the ones behind some of these apps, because I think the public in general wants to be sure that their privacy is protected. And the one thing about these apps is they kind of follow you where you go, and that's all part of the effectiveness of them as tools for contact tracing. So it's a delicate balance, there's no question.
And I do want to ask you, and I feel like I ask you often, but I think it's important to do so because I get a number of questions myself from viewers about this. But as we see economies reopening at various speeds, people have a lot of questions about what their own behavior should be. And especially when part of the reopening or relaxing of the restrictions includes bubble families. You can socialize with one other family, or the number of people that can gather outside has increased by a lot in certain provinces. I think those questions persist around what should my own behavior be, how many changes can I make and still be safe, and what is your advice to people who have those questions?
Well, I think again, I go to that common answer of common sense. I think that people should continue to practice some physical distancing when they can, and that would be important. We know that outside activities, not in an enclosed environment, not with the sort of household environment, which we know is probably the most important one to facilitate transmission, are pretty safe. I would, I certainly support the use of masks, but I support them because I think they're symbolic of what we all would like to do, which is to protect ourselves and protect others around us. Masks are not actually, cloth masks in particular, I should say, are not particularly effective, and there's lots of science to support that. But I do support their use because I think it's sending the right message. So really, it's just a matter of maintaining a number of the practices that we've gotten used to over the last few months, and not completely, getting rid of them suddenly and abruptly, because there's no question people are starved for social contact. But right now we have to be careful, and we have to be very much deliberate in how we phase in some return to normalcy.
Okay, I'll leave it there. Appreciate your insights and expertise as always, Dr. Evans. Thanks so much for coming back on the program.
Thanks for having me, Vashi.
A warning from healthcare officials. Canada is not prepared for a second wave of COVID-19. That was the message this week from leaders representing the country's doctors and nurses who were speaking to a Senate committee. According to one of them, reopening economies right now could be a gamble since we're nowhere near the level of testing we need to be at. So is there still time to better position Canada for a second wave? What needs to happen in order for that to be accomplished? We've reached Dr. Sandy Buchman, head of the Canadian Medical Association in Toronto. And also joining us is Claire Betker. She's the president of the Canadian Nurses Association, and she joins us from Winnipeg. Hi to both of you. Great to have you with us on the program tonight.
Hi, good afternoon.
Dr. Buchman, I'll start with you. As we just mentioned, you told a Senate committee yesterday that we are gambling with reopening. What led you to that conclusion?
Well, we know a second wave is coming. There's never been a case in recorded history where a pandemic didn't have a second wave, and usually it's worse than the first wave. We were able to mitigate the effects of the first wave through social distancing and all the public health recommendations that we had. But now we're sort of seeing still increasing rates of the disease in the country. And yet we do know that we don't have an accurate picture of the prevalence of the disease in the community. So we haven't even been able to get our testing numbers up. That's been noted by recently, even today, the Premier in Ontario, for example. And so it's really important in order to be able to make evidence-informed decisions, in order to be able to reopen the economy, schools, hospitals. It's critical that we do so. It's important to get the evidence-informed decisions that will allow us to identify people in the community who may have COVID-19, and then trace those contacts so that appropriate information to them and restrictions can be put on place. By targeting perhaps healthcare workers, other high-risk individuals such as grocery store clerks or transit drivers, we'll be able to get a much better, accurate sense of how much disease is in the community. The virus isn't going away. It is with us. And we really have to know if it's increasing, decreasing, and then able to make the right decisions.
Ms. Betker, you also spoke to the same committee. You raised concerns as well about testing. What are your thoughts on some of the challenges that we've seen so far where testing is concerned?
Well, nurses, as they've been telling us, the Canadian Nurses Association is the national and global voice of Canadian nursing. And nurses, if we've been in conversations with them, are very concerned that the testing numbers aren't up and that we won't have, as Sandy said, the evidence-informed or the evidence to make those evidence-informed decisions. And nurses do a lot of that testing and case and contact follow-up. But it also requires those data systems in which the information can be there and it can be analyzed and looked at from a pan-Canadian or countrywide perspective.
Dr. Buchman, does it depend where you live? And I ask because we have seen, much lower case counts, for example, in BC and Alberta. We've also seen wider testing criteria in those provinces, a higher per capita testing rate, even testing processing, I guess I should say. Are your concerns more amplified in certain regions?
Yes, they are. I mean, we can learn from each other, and places which had more widespread testing and contact tracing were able, it seems, to get the control. We also know that from other countries. So in those areas of the country which are worse, such as Ontario and Quebec, I think it becomes even more incumbent upon us to really scale up widespread testing and contact tracing. And now's the time to do that.
I see you nodding, Ms. Betker. Do you have concerns, particularly in those provinces as well?
Well, those provinces, and I think in some of our more remote and rural communities, I mean, as things move along and as Dr. Buchman said, the virus is with us, making sure that those systems are in place in those communities as well, and that we have the type of information that we can actually make good decisions on.
Dr. Buchman, the premiers are on a call at this very moment with the Prime Minister. The Prime Minister signaled this morning that a big part of the conversation would revolve around increasing capacity for contact tracing as well as testing. What role do you see the federal government playing in this?
Well, this is great news to hear that the messages are getting through. And of course, the question always sort of is occurring is, why has this happened? We know what to do. We have excellent public health experts, and it's kind of hard to understand why it hasn't happened yet. Has it been underfunding of the system? And I mean, that's been a chronic problem in Canada, but what's happening right now? So it isn't entirely clear, but it's actually great news to hear that we're finding the way, and the federal government has the role to create the funding and the requirements that all provinces be supported in undertaking increased testing within their jurisdictions, particularly those areas that are hard hit by COVID.
Ms. Betker, I want to ask you as well about the subject of personal protective equipment. That was a big part of the conversation at the outset of this pandemic. We were hearing from a number of doctors and nurses who were very concerned that if the surge that was expected came, they would not have enough personal protective equipment. There was a lot of stress involved there. What are your feelings right now on the level of PPE for nurses across this country? What are you hearing from your members?
Well, what we're hearing is it remains a concern. So we're certainly not taking our foot off of, sort of that pedal, if you will, in terms of making sure that we keep that top of mind for decision makers. But they were worried not only about the type, but also the amount and the guidance. Excuse me, making sure that there was consistent guidance, consistent information provided in a timely way. But not only to health, but also to our social services colleagues, those that are also in very close contact with the public. And I think we saw in the long-term care sector that some of the perhaps lack of testing, the lack of having access to guidance and personal protective equipment, what happened actually in that sector. So I think members are still wanting caution and evidence-informed decision-making.
Dr. Buchman, you represent doctors across this country. What are you hearing from them where PPE is concerned?
Well, I echo Dr. Betker's concerns and what she's heard from nurses. We're hearing the same thing. We undertook two major surveys of our membership and got fantastic responses, one at the end of March and another towards the end of April. And we heard that doctors are experiencing a huge amount of anxiety in not knowing if personal protective equipment was coming their way. A third of our doctors reported that, particularly in the community, that they only had 1 or 2 days supply of personal protective equipment. Doctors on the front line reported not knowing in their hospitals how much they had. About 29% said it had actually gotten worse from late March, and about 42% said that there was no change at all. So we're still hearing that they're quite distressed about the lack of PPE as well as the quality of PPE.
Okay, I'm going to leave it there. Thank you very much to both of you for your time this evening.
Thank you.
Sandy Buchman is the head of the Canadian Medical Association, and Claire Betker is the president of the Canadian Nurses Association. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.